I'm actually scheduling in the habits that will help make me healthier, like working out and meal prepping so that I always have healthy options. Because just like we plan ahead for our work meetings, for our conferences, and just for our busy work schedules, it's also very important to plan ahead when it comes to taking the actions to keep us healthier. Because when you plan ahead, you set yourself up for success. Not planning means that you're setting yourself up for failure.
Bismillah ar-Rahman ar-Rahim and happy Ramadan. Today I'm going to talk about people who did procedure to reduce the weight, like the surgeries for the weight reduction surgeries, such as sleeve surgery or bypass surgery, or they put a balloon for reducing the weight. All those maneuvers can reduce the weight, and it has different effect on the weight. People who already did this or did those procedures, they usually during fasting, if they just recently did it, most of surgeons, they don't recommend that they should fast within the first 3 months of the procedure. Why? Because they have difficulty to keep things inside their mouth, so they have to keep drinking water a little bit and to prevent the dehydration that might happen. Okay, is number one. Number two, people who already did it since long time and they need to keep their weight in a safe way and do not regain weight. So those people during Ramadan, we recommend for them that they should watch their diet and decrease the amount of carbohydrates and high fatty meal and simple sugar drinks during Ramadan. So to save your weight and to regain weight, to avoid all of this, you have to have a control and healthy lifestyle during Ramadan with decreasing all the high calories diet and all simple sugar. Also, we recommend for them to drink a lot of water plus a lot of drinks that has not much of sugar and high calorie. Also, we encourage them to do exercise. Usually we recommend for people who don't have diabetes, their exercise can be done at any time. But for people with diabetes and who's taking any insulin, if they did those procedures, we recommend for them they do their procedure not before iftar, they do it after iftar, so just to avoid the low sugar that might happen with their treatment. So in general on this, we recommend for them to keep their healthy lifestyle. And when things might happen for people who did mainly bypass surgery or sleeve surgery, they might develop hypoglycemia, low blood glucose, after taking a lot of carbohydrates. So they drink juice or eat chocolate or eat sweets, and after half an hour they might go low sugar despite going high sugar. This is what's called dumping syndrome. So this has happened after those procedures. So if they have symptoms of low sugar like palpitation, their heart is beating, sweating, dizzy, after a high sugar meal, they should check their blood sugar just to make sure that they do not have any hypoglycemia, any low sugar. Thank you for staying tuned. Now we're going to talk about the medication that might be used to reduce the weight. Those medication, we have injectable medication, injections, and we have different kind of injections. Those injections, we have it injectable once a day or twice a day or once a week, okay? So we have different companies and different doses and different medication. How those medication work? Those medication will work in the satiety center in the brain and let the patient feel, let the person feel full, and those medication will reduce the appetite, obviously, so they might lose weight with those medication. One of the side effects of those medication, they might have nausea and they might have vomiting, okay? So that's why during Ramadan it might be tricky to take those medication. So we recommend that those medication to be taken before the iftar. Why? Because most of them, and the famous one of them, will work within 10 hours only. So we need those medication to cover the period during the iftar period, not the fasting period. And also if they have side effects from those medication, they might take any medication, help them with reduce the side effect. Those medication might help to lose weight, varies between 4 kilograms. Some of them lose 2 kilograms, and some of them lose up to 25 or 30 kilograms. This depends on each patient variation. So this is not specific for one medication will drop this amount and other medication will drop that amount. No, it depends on the patient lifestyle and depends on the patient, him or herself, because some people lose weight with it, some people do not lose with it. So common question during fasting is those medication will cause low sugar, will cause hypoglycemia. The answer, usually those medication will not stimulate any insulin secretion and they do not cause any hypoglycemia. That's why it's safe to take them during Ramadan and has no issues with the hypoglycemia with it, okay? Some people who's taking those medication that injectable once a week, so the first 1 or 2 days they inject those medication, they might have significant nausea, so they might feel need to vomit, okay? So they have to watch those medication if it's taken during Ramadan, so they might need to inject it during the time of iftar, so they will not force to break their fast, okay? As we mentioned, those will not cause hypoglycemia, but to have those medication also have a good effect and do not regain weight and you will not lose the effect of the medication, we suggest for people who's taking those medication to have regular exercise during Ramadan anytime, because this will not cause hypoglycemia. I mean hypoglycemia means low sugar is number one. Number two, they need to take a healthy lifestyle during Ramadan with the food. So they have to control their diet, they have to cut down the simple sugar, they are taking the high calorie drinks and fatty meal. So otherwise they might lose the effect of the drug and they're injecting medication and they are not getting the benefit from that, and they might regain weight again or their weight might be stable during Ramadan. So what we recommend for them with those medication, because they need to keep losing weight and it's a good opportunity during Ramadan to lose weight, during the iftar period, take healthy food and cut down the simple and high calorie food. All of this should be done under the care of a treating doctor. So before you get fast, if you did any procedure for surgery before, double check with your surgeon, or if you are taking the injectable medication with your endocrinologist or general internist, you have to chat with them and discuss that you want to get fast and what things you need to change during fasting. Barak alaykum al-shahr and happy Ramadan again.
Now, I fully planned my week ahead of time, from socializing to work commitments, and most importantly, to working out, exercising, and eating healthy. Now, the last part is very important because according to a recent study published in the British Journal of Health Psychology, they looked at 250 individuals. These people were broken up into 3 groups. The first group was asked only to work out, over 2 weeks, the second group was also given motivational videos to watch, and most importantly, and this is the most successful group, they also wrote down their plans to work out. So very specifically, they wrote down that I will work out tomorrow at 2 p.m. And this group was definitely the most successful in their pursuits to work out over 2 weeks. And so, just like me, be sure to plan ahead for your week and especially for working out.